go into the general questions, and this is open. I might direct them towards individuals, but anybody can feel free to jump in. One of the questions we had: who's responsible for health professionals learning and knowing about racism and Aboriginal and Torres Strait Islander people? Australia frames this from perspectives of culture because it's more palatable. We can provide our own experiences of racism, but at some point health practitioners need to be responsible for their own learning so they can get on the path of being an anti-racist health practitioner. Only then can we be ready to learn more about cultures. So that's a general statement by way of a question and statement. Anybody wanted to respond to that? Whose responsibility is it?
Well, like many people have been sort of saying on the forum, you know, we're 3%, 3.5% of the population. We definitely don't want to be responsible for doing all the hard lifting for the 97%. But a lot of this comes down to what other people have said. So you need to educate yourself. There's plenty of resources out there. I mean, I've been involved in developing some for some health professions like nursing. So I'm a former nurse. I know there's a mandatory text that a whole bunch of, or Carmen was an author, I think, in that as well, where we wrote for all. So it's now a mandatory text for all undergraduate students so that people, you know, can learn the history, a bit of truth telling, but then see how that manifests and how those professions contributed to the history of this country and what happened. So there's that side of things. There's also an issue, I think, in measuring, you know, because I measure things, that we don't measure and report on things like implicit association tests or the extent of racist attitudes amongst healthcare professionals. I think if we were really serious about this, our registering bodies would be surveying members or representative samples to say, well, what, you know, do medicos hold these racist attitudes? Because then the regulatory authorities can deal with that kind of stuff. That is a novel idea. And then there's also, you know, there's lots of good programs and services that talk about, well, if you're exposed to Aboriginal and Torres Strait Islander people, cultures, and show interest in that sort of stuff, you hold, I think this is from Reconciliation Australia, actually, Karen, that you hold less negative views. So there's kind of 3 levels I can throw at you.
Mm. Yeah, and I mentioned the Indigenous psychologists working with the Australian Psychological Society and the work that they're doing, and it's incumbent on all the health professionals and allied health professionals to get involved. And I know that IHA is doing a lot within their membership to empower them to work with their non-Indigenous colleagues as they go back into their workforces. So yeah, it's all of our responsibilities, but it's not Aboriginal and Torres Strait Islander people's responsibility to educate the community solely. And so we all have to take that opportunity to do it. I had another question. Do you think unconscious bias is a valid term? I'm a non-Indigenous person and have conversations about racism with non-Indigenous colleagues, and I find it is used as an excuse, not a reason to challenge our unconscious bias. At the same time, Kath Wilson, who wrote this, she says that she's learning a lot from her Indigenous academic colleagues, and so I guess it's as much, again, a statement, but it is an issue about unconscious bias and how do we address it. And maybe, Karen, that's something that RA is doing a bit of through the education of the population through RAPs.
Yeah, look, it's something that's been happening quite a bit in that kind of diversity and inclusion space, that particularly happens within the corporate sector, but increasingly across workplaces. I guess it kind of links back to not only unconscious bias, but kind of these ideas and understanding of privilege. And I think lots of people will use lots of reasons as an excuse not to engage in whatever. We can call it any number of things. There was a period when we didn't talk about racism. We talked just about discrimination. We talked about other things. I think that's one of our challenges, and that's part of what our call to action is all about, is how do we actually, and when I say we, not me and certainly not First Nations peoples, but this cohort of allies that are putting their hand up and saying, okay, this is not right. How do we get them to talk to their people around what this looks like, what this means, and unpack it for themselves? And that will look and sound differently for others. But again, I've got this amazing experts here who know this stuff more than I do.
Yeah, and Karen, the media also has a responsibility, because they have a significant role to play in what they say. And you've been doing a lot of work over a number of years with Media Ring. And do you just want to mention something about that?
Yeah, so essentially it's a bunch of media organisations that most of whom have RAPs, but not all of them, who came together to think about collectively what can we think about and how do we think about not only, again, as a workforce, but the particular role that we play in informing Australians. So again, it's sort of chipping away at things. Of course, the ABC and SBS do such amazing work. Again, talking about things about naming and place names and acknowledging traditional countries on the local news. And I just saw Channel 10 this week are doing that on the weather maps, which is amazing, and have really leaned into their conversations around racism, and particularly last year around the Black Lives Matters movement, and particularly the pattern, what are they called? The project. So, all of these things are really important, because not only do they frame how we think and talk about issues when they flare up, but it also informs a huge population group. And it can misinform a huge population group if we let it. So I think there's really importance, but it goes beyond just, again, the news and the way we report news. It's, whether we see Aboriginal people on Neighbours, or, whether we're seen as being part of the community or not, and only ever seen in these negative kind of portrayals when it's, being an angry person, in a shop, or protesting on the street. If they're the only ways that the broader community get to see Aboriginal people, then it skews our perceptions.
And it's been fantastic the way that during, the Black Lives Matters marches and marches for reconciliation, we see a significant number, the majority, in fact, of the participants are generally non-Indigenous people. So that's really a lot of people keen to work with us, and that's going to, I think, make a difference into the future. Carmen or Ray or Lalani, any comments?
Yeah, I was just going to add, even though I talk about unconscious bias or structural bias in my research, one of my participants actually said that don't dance around it, call it what it is, racism. It's time for us to start having these conversations, and it's time for us to really understand how these institutions operate, and these are the types of conversation that we need to have to learn, so that we can dismantle some of the impediments that exclude our knowledges and ways of being, knowing and doing.
Thank you. Right, so any other questions come up, Abby, or Vita, that we need to address?
A question for all panellists. What advice do you have for those of us who are working within healthcare services for the general population to ensure we are providing the best services we can to Aboriginal and Torres Strait Islander consumers? And also any advice on recruiting Aboriginal and Torres Strait Islander healthcare professionals to work within our services?
I'll start.
Okay, go on.
I think it's kind of, that's actually a really big question, and the reason is because there's so many layers to what that really looks like. And actually, in going back to even actually APRA have co-designed a process with Aboriginal and Torres Strait Islander people to define what cultural safety is, and that is really that it's not up to the organisation to say that they are culturally safe. It's up to us as Aboriginal and Torres Strait Islander people to say that. And I think that goes back to the importance of actually looking within first. And when I say that, I respectfully mean that the organisation at all levels really needs to look within and understand what their understanding is. Is this something that they've considered? And if they haven't, why? Is there a reason? Because often there is, and it's either that there's been a lack of education or understanding on what are those considerations and what they should look like, but then also a lack of commitment and I guess resourcing to support staff and the people within the service to better understand that, so that they can really start to address and provide a service that's culturally informed and safe. And that looks different for each community as well, and that looks different for the people that you're working with and the people that are actually attending your service. So you have to look within and really understand what that journey is, and I think people power has a lot to say for that. I've seen that in my workplace as well, across the whole organisation, where they have actually committed to, in their next 5-year strategy, which we've just started, one of the 4 core pillars of the Black Dog Institute is being a trusted partner to improve social emotional wellbeing in Aboriginal and Torres Strait Islander communities. And that's huge. It's unheard of. Mainstream organisations don't usually commit to that. That commitment was made by our board and our executive in the first place, but it was backed up by some work that I did in understanding what our staff wanted. So just to really say, I think there's so many complexities in answering that question, but I think it's really important to look inside first and to really see if your organisation is even ready to do that.
Yeah, thank you, Leilani. Look, I'm conscious that we are, as always, coming up close to closing time, and we're getting comments and questions coming in, which we won't be able to address. If I can just seek your indulgence for another 5 or 10 minutes, we will just close off the session. We're going just a little bit over the 3:30 deadline, but we will. So can I thank our 4 panelists and for great presentations and from the heart and from the research that you've done and the experiences that we've encountered as Aboriginal and Torres Strait Islander people. Any last comment from the panelists before I do go into the closing off session? Okay, well that all seems good. Look, I mentioned earlier that we wouldn't be able to respond to all the questions, in these panel sessions, but we will try and pick up the key themes of those in the Poche opinion that we'll develop, which is the paper that sort of encapsulates the presentations and the comments that were made, and particularly look at some of the future directions that we might be able to offer to policymakers in how to address this issue. I'd also like to recognise, and it was mentioned in the chats, people like Yin Paradise, who's been working on, Professor Yin Paradise, has been working on racism and discrimination amongst our people for decades now, and is one of our pathfinders in this space in bringing it to our attention. But unfortunately, like everything in public policy areas, they sometimes take decades to make a difference. But we are seeing that a little bit more scope and a little bit more address of some of these issues. There's been many themes that came out. Some members of the panels might think, well, look, there wasn't enough specifically talking about the health systems and so forth. And that might be the case, but we could rattle off all the statistics about discharge against medical advice and why people don't use services and so forth. But that's not, that's known, and those statistics are pretty much available for people to look at, and people who work in this space do understand that, I think. What we wanted to do was to provoke some thinking amongst all the participants about why peoples, across the nation think like they think, and what that means to Aboriginal and Torres Strait Islander people from our personal perspective, and how that does have an impact on our health, which is the whole gambit of health when we talk about it. Mental health, social, emotional well-being, and as well as physical health, but also in the preventive health space, to make sure that if we can address some of these issues, address our own personal understandings, then we'll see a difference. People out there who may be representing specific professional sectors, we've mentioned the Indigenous psychologist. Just last night there was a great webinar that was convened by the Academy of Science in Canberra, and hosted by Professor Fiona Stanley, and had in fact one past Poche, the inaugural director of Poche Sydney, Dr. Nairi Brown, and a current director of Poche in UQ on board, and they presented on behalf of the Academy. That's James Ward, sorry, I should say, Professor James Ward, talked about research and how attitudes about Indigenous peoples impact on research and a whole range of issues. So that's up on YouTube if you want to have a gander at that. But that's again another professional body that's trying to influence their members to think differently. Where that was the objective of this session today. So I'll close by not only thanking our panellists, Carmen, Leilani, Ray and Karen, but also Abby and Vita and Michael, who are behind the scenes, did a lot of the work to get this done. I mentioned we will have a Poche opinion paper out, in a couple of weeks, 2 or 3 weeks. We will try and respond to the questions online. I think, as I mentioned, a number of them were there. We still had over, 300 and, when I last looked, about 360 people online, which is fantastic. It just means that we are reaching people and that there is a great interest out there to hear what we're doing. Just by way of a bit of crude promotion, I should say that the Poche Indigenous Health Network and Poche Sydney are hosting the 10th annual Aboriginal and Torres Strait Islander Health Research Showcase on the 17th and 18th of November. And you'll have to put up with me again as the host and facilitator of those. But we use it as an opportunity to run, a series of short presentations that cover a very broad range of health initiatives that aim to improve the health and well-being of Aboriginal and Torres Strait Islander people. And so it's all about the research, not only that we do at University of Sydney and through the Poche Indigenous Health Network across the 5 universities, but any prime research. It was done live. Last time it went over 2 days, so you need to bring a cut lunch to be able to participate in it. But they're fantastic opportunities. Anybody who's interested in not only observing, but if you've got Indigenous research that you want to be able to share, up on the there'll be a link put up on the Q&A here on how to get involved and what Rachel's email address is. But you can submit an abstract of 200 words by the 24th of September, just a brief outline about your project, and that'll be considered by an esteemed panel of people on it. And I know Carmen's addressed it a number of times, and it's a great opportunity to what we're trying to do is to foster and encourage and create a platform for Aboriginal and Torres Strait Islander researchers to be heard, because we know too often with research or with PhD dissertations and other activities that you don't get an opportunity, particularly as an Aboriginal and Torres Strait Islander people, to be able to share your learnings and experiences. So we're creating that opportunity. So come on board. And I'll close by saying, again, happy NAIDOC week, everybody. Heal country is a theme. Get to understand what that means, and all do our part. Thank you for your participation. Thank you for your interest in Aboriginal and Torres Strait Islander affairs. Thank you for being, forward-looking, to look at us not from a deficit discourse, but one of empowerment, enrichment, of future, where we can all have a very reconciled community, and that we can address. And we can only address it if we do it together. And as the Australian Human Rights Commission says, racism stops with me. If we can all address our own racist and discriminatory attitudes and practices, if we can address our unconscious biases, we'll stamp it out. And that's what a good future for all of Australia is all about. So thank you, and we'll see you in September. We'll see you in November, but we'll see your abstract in September, if not before. Thank you. Stay safe.